The Jackson Free Clinic is a student-run free clinic. We were founded about 10 years ago by the students in the family medicine department and by Dr. Joyce Olatati, also with family medicine. And since then, we've grown to include the School of Dentistry, the schools of health-related professions, and of pharmacy. We're open every Saturday. Mostly what we do is like chronic diseases, so diabetes, hypertension, high cholesterol, that kind of thing. All of our patients are uninsured, so they share that kind of common denominator.
Considering that I don't have any health insurance, the cost of health insurance, this is perfect. I mean, it's a good place. They seem real knowledgeable, and I know they'll probably take more care than maybe a regular doctor, because there are students with doctors, and if something they don't know, they can get with the doctor, and then they'll probe more into your, give you more care and probe more into your problems of what's going on.
How hard is it to go in there and see a new patient who's got a complicated history?
It's hard, but it's one of those things that it's kind of like, that's why we're in med school, to learn. I mean, it's kind of like reporting. You're taking a group of facts and trying to form it into a coherent story that you can communicate effectively to the rest of your medical team so that they can help you plan what the best treatment for the patient is.
I think the students here get experience communicating with patients, experience teaching. They do patient education, but they teach each other. Whereas the fourth years teach the third years about plans, the third years teach the second years about doing exams, the second years teach the first years how to get a history, so everybody has something to contribute.
How helpful is it to have an M4 working with you like this?
Well, it's really nice for me just because, these first 2 years we're only in the classroom, and, getting to come here as an M1 or M2 kind of gets you to add some depth to what we're learning in the classroom, and then having an M4 just use this as a teachable moment to really solidify some things that we've learned in the classroom. It's been great.
Sometimes it's good to get away from the books and realize why you're actually here, so it's nice to come down here sometimes.
They will call the patient back, they'll do the vital signs, they'll talk to the patient, they'll examine the patient, then they come out and sit down and try to form a plan about what's going on, and then they come and present to one of the volunteer attendings.
So some of these are attendings, some of them are residents, and we also have pharmacists here.
We try to make it clear that that we're not the ones making the decisions, that we're going to be talking to them, but we do have a physician that we check with and who will come and see them at the end of it.
We go see the patient with them. We help them learn how to order labs, how to write prescriptions, alternatives to what they want to do that will be less expensive to the patient, and try to include the social aspects of medicine as well.
I love taking care of patients. I love adult patients. A lot of that has been fueled by many things, but especially my work here at the clinic, and just getting to interact with adults and talk to them, about their life and get to know them and about all their issues, not just, you need to take this medicine, really getting to know the heart of kind of who they are and how that affects their life.
I mean, we really enjoy spending our free time here. It's not anything that we're required to do, but I think the people that come volunteer and spend their extra time here checking it out, they really enjoy it. They get a lot out of it.
I heard about it, that the university hospital have student doctors, but this is my first time experiencing that, and it's good. It'd be a team of them, and they'll talk to you too about your health problems, and then they'll get with their doctor and discuss it with them and try to get help for you.
We'll see about 20 medical patients a day, maybe 5 PTOT patients, and on dental days we see about probably 8 on average.
Today is my initiation into the Jackson Free Clinic. I'm kind of excited to see, what goes on here and how we help to serve the local population.
Here at the Free Clinic, it's different because we're seeing patients that are coming in on an emergency basis. We're at the dental school, the patients have already been screened for what they possibly need. When they walk in here at the Free Clinic, we don't know what they're going to need or what problems they might be having.
Around this area, it's a lot of extractions. Everybody doesn't have access to dental care, so we try to cater towards that crowd and help them out.
He's got a fairly complicated medical history that takes a little bit of management to taking care of. But he took his meds and everything this morning, so he should be good to go.
Diabetes and hypertension.
Diabetes and hypertension. A lot of Mississippians here that come to the free clinic.
I'm here lots of weekends. Well, it's just an opportunity to give back, really, and share. All week, I focus on me, but on the weekends, I just get this opportunity to, share what I have, my skills, my knowledge. We do have some extreme cases that come through, but for the most part, we're able to take care of, their major needs.
I love helping people, I love communicating with the patients. I love working with students from other disciplines and showing them what pharmacy can do, what role we can play in helping them out and working towards the overall goal of serving the patient.
We're basically just a general outpatient clinic. We treat a lot of musculoskeletal problems. I have a couple of neuro patients, but mostly joints and things like that. Physical therapy and occupational therapy are both 3-year programs, and you can come starting your first day of your first year all the way to graduation.
I think it's a time to work with the students. Compared to the clinic setting, it's a lot slower. Like we might have one patient and we can take our time, and we have OTs and PTs working together to solve problems with the patient. So it's a very unique learning environment.
Why did you come in today?
Because I have a problem with my shoulders, basically when I use it.
You get a real team of people working on you too.
Yes, they've been great.
This is a pretty typical Saturday, pretty busy. We had a lot of volunteers and a lot of patients, but fairly typical.
Today I'm supervising the clinic. I'm on the board of directors. I'm the chairman of acquisitions, one of the 3. So we're just getting the office organized and making sure patients check in and all that good stuff. As medical students, this is like the first time we really get patient contact early on in our medical school careers. The first 2 years are mainly in the classroom. So if you don't really try to get patient experience, you're not going to get it until your 3rd year. So we get here, we get to learn some skills from the upper level students, and they teach us things so that when we hit the actual wards in the hospital, we're more prepared and we have a few skills that we can take with us there.
It gets you out of the headspace of being in the class all the time. You tend to get a little overwhelmed with books and tests and all that kind of stuff, and this is a good place to come see, that there's light at the end of the tunnel, that you're doing this for a reason. It's just great all around.
It's a two-sided thing for me, not only being able to give back to the community and help patients that don't have insurance here in Jackson, but also the teaching aspect of it. I think that's such an important aspect of medicine, and being able to do that here at the clinic by me being able to teach M1s and M2s and me being able to get taught by interns and the M4s that come here.
What were these patients doing before they came here?
A lot of them were going to maybe federally qualified health centers where they get a sliding scale, but a lot of that was still kind of out of their price range. But a lot of them were really just kind of falling through the cracks and not getting any care at all.
There's always needs for funding here. It is all volunteer. They've written grants to get money. They've done projects to raise money. And just to keep it open and pay the utilities takes money. So they're always looking for contributions and just ideas to raise money.